Please join me to welcome Dr. William Latimer.
Thank you so much. What an impressive group and an amazing series of lectures, just incredible. Sarosh warned me that when I was going to be following Dr. Melnick that her nickname should be Impossible Act to Follow. So I knew what I was up against. I'm so pleased to be here. I'm so pleased to be back in New York, me and my family. So pleased to be a part of the Lehman community. I think the mission of Lehman as a college is so consistent with so many of the values and the things that are being said by the various speakers, namely providing an affordable education to a lot of folks in the Bronx that probably wouldn't otherwise get an education, and by virtue of that education, really giving them an opportunity to raise themselves up in a way that wouldn't otherwise just simply not happen. And so proud to be a part of that team. I also want to very much thank Sarosh for inviting me to present briefly. I also want to say over the last couple of months when I've gotten to know her by Skype, some of you may have heard of this or seen it read about it in the Times. Sarosh and I have created a new form of Skype communication. It's called the roving camera version of Skype. We both had cameras that were adjustable, and so when we would be talking, I'd see half of her face, and then she would see my right arm, and then I would see her forehead, and then she would see my teeth, and so, you know, every talk was always so exciting because we were talking about important things and, you know, things we want to do together, but you just never really knew what was going to happen next, so it was always very exciting. So part of what I'm here for is to talk about two things at least. You know, as I was listening, I kind of wanted to chuck my prepared remarks because there's just so many things that it's making me think of as I listen to these great talks. So one of those things is, what can the role of research be in promoting a culture of peace? Because I'm one of those folks that has spent a lot of their time doing research and doing NIH-funded research, which is a particular kind of research in itself. And one of the things that I think of is that when I work with trainees at any level, whether it's kids we've recruited from community colleges to four-year colleges to doctoral students to postdoctoral students to junior faculty, I often say over and over again, 80% of what we learn in research our grandparents could have told us anyway. They would have known it, they wouldn't have needed to do the big study, but it's still important because a lot of times it's not conveyed to the masses. And I can't think of a better example of that, sadly, than intimate partner violence. Granted, as Dr. Melnick is saying, things have changed in the last few years, that it's being recognized by international agencies as an epidemic. But you don't have to go back too far to find a period of time where really there was no dialogue about intimate partner violence. There was no voice about intimate partner violence and its absolutely horrific effects, mostly on the lives of women. For what it's worth, we did a Public Health Minute segment, it's a radio show, just the other day where an expert talked about violence of women against men is actually a silent epidemic that no one knows about, but certainly 98% of intimate partner violence is men against women. So what I want to say first is that it's critical that we state the obvious to the masses. I would love to have it's great that BronxNet is televising this live. That means it'll reach hundreds of thousands of people that it wouldn't reach otherwise. But we need to get these messages of the 80%, the things that our grandparents taught us, the values that we learned from them, to the masses to inform policy. So that's the first point. Second point is that I tell my trainees that 20% of what we learn in research is not obvious. It's not obvious. And that is so important to know and to learn when we want to develop programs to inform clinical practice or to change behavior or to do whatever it is we're trying to do on an individual or a global level. So for example, I think of the work of Gisela Konopka, a Holocaust survivor, who did groundbreaking work with teenage girls and that were in gangs. And what she found through empirical study and through qualitative interviews, that adolescent girls that were violent, that gravitated to gangs. Now, this is going to sound obvious, but you got to understand that at the time, it wasn't obvious. Gangs are bad. If you go to policy even today, gangs are bad. We got to identify gangs and we got to crack down on gangs. We got to get rid of gangs. Well, what Gisela said 30 years ago was that what gangs were doing in the lives of those teenage girls was giving them a sense of belongingness that they didn't have otherwise, that they were gravitating to gangs because they didn't have someone in their lives that was taking care of them. Didn't have to be a parent, could be a priest, a rabbi, a minister, it could be a teacher. But if they didn't have that sense of connectedness, then they were much more likely to get into gangs and much more likely to become violent. But that understanding of the function of gangs radically changed the way people approached gangs and working with gangs and worked with teenage girls that were at risk. When I think about HIV in our work, we've been doing work in South Africa for the last 14 years and then in Baltimore for the last 20. And we found several findings that were obvious, like poor access to healthcare, poor access to education, and what might be called the right to self-determination are all associated with higher rates of HIV and a wide range of chronic diseases. Now, that's not news. It's important to sing that to the hills, but it's not news. We know that. But what we also learned were things like cocaine use is the primary illicit drug that's associated with HIV and STI transmission, much more than heroin or other kinds of drugs. We also found in South Africa, and this was very counterintuitive, that for men, cocaine use was associated with HIV transmission, but not for women. And that didn't make any sense at all. It's not intuitive. So we looked further. And what we found in that sample, and I don't know if this is sample specific, but through qualitative interviews that we did at follow-up, we found that the women that were able to buy cocaine had more money. By virtue of the fact that they had more money, they were less likely to trade sex. And trading sex was the #1 predictor of HIV seroconversion among the women in our sample in that study. So cocaine use became a proxy for something else. And my point is that I will say for myself, I never would have dreamt that. I would not have thought that the case. So my main message here is simply that my hope is that research, that folks like the people in this room that have such enormous resources and access to policymakers, to getting the word out, think of researchers as your allies, as people that you can partner with to develop programs that will have the greatest chance of success when trying to promote a culture of peace. Because I would also argue that reducing HIV and promoting health equity is absolutely consistent with developing a culture of peace. The one other point that I want to make before I move on to the Tanzania Project is that it's also important to talk about that it's not easy to do research on the topics that we're discussing. I'll give you one anecdote, okay? I had been doing HIV research funded by NIH for about 12 years, and one of my postdocs came to me, and Courtney said, "Bill, you're not studying intimate partner violence in your studies, and you have to. It is an absolute gap in your research, and if you don't include it, you're really missing a big picture." And she was being mentored by a good friend of mine, Jackie Campbell, in the School of Nursing at Hopkins. And I said, all right, let's do it. So for the next study, we had a 1-year NIH study. Most of the studies are 5 years, 1-year study. I then submitted what you have to submit, an IRB, an Institutional Review Board protocol, to get ethics approval to do this study. And because we included domestic violence or intimate partner violence in the study, guess how long it took to get the study approved? And I'll give you a hint. Most studies take about 3 months. This is a 1-year study. How long did it take to get IRB approval to do the study because we had intimate partner violence in it? Take a guess.
A year.
Exactly. It took a year. So we had a 1-year study, and it took a year to get the ethics approval to do it because they wanted to make sure that we had the right safeguards in place so that if we identified, they knew we were going to identify women that were victims of intimate partner violence of all kinds, whether it was sexual, physical, verbal, or any other. And so they said, if you're going to do that, then you have to have some kind of mechanism to assist them. You can't just leave them in their situation, which of course is true. But bear in mind that if you're in a system that takes you a year to get IRB approval to do a 1-year study, that is also a barrier. So there are issues in research that also are very relevant to thousands of junior faculty that are trying to get grants that are doing research that are so relevant to promoting a culture of peace and promoting health equity. Okay, so with that said, one of the key things that we know for sure for decades now, I mean, this is like, it's a linear line straight up, and that is more education, better health, plain and simple. And certainly another thing we know that's like this is better access to prenatal care and better maternal and child health, and it's a linear line. It's always good, and it leads to positive outcomes in the lives of mothers and children and everything that happens thereafter. So the Tanzania Project is born as, I think it's the passion, certainly, of Madame Nehru and Soros. And our goal is to develop a project where we'll take nurse midwives in Tanzania, bring them to Lehman for 2 years of training in emergency obstetrical care so that they then can return to Tanzania and provide improved maternal pre- and postnatal care in rural settings, but then also serve as models to train other nurses to provide the care that they've been trained to do. So I've tried to do my best to let Soros, because she's a passionate woman, know that even when I was at Hopkins, it took me 2 years to get funding for a very similar program from the State Department, and that we're completely behind getting this program funded, and I'm utterly confident that we will. It's part of the journey of finding the funding source that will make this program a reality, and I would imagine that I might be turning to some people in this room to help that become a reality. So with that said, thank you so much for the opportunity to come and speak with you. Do not hesitate to follow up with me if you have any questions or want to make connections to Lehman, and thank you so much.